Welcome to the Explainer. Today we're going to do something really cool. We're going to explore the incredibly complex structures of the human body, but we're going to do it exactly like a cartographer mapping out uncharted territory. Just imagine, for a second, trying to navigate a vast, newly discovered continent, but you've got no compass, no grid system, and totally lack a shared language with your crew. Well, believe it or not, that is exactly what medicine was like before we developed standard anatomical terminology. In this explainer, we're going to build your medical map from the ground up. We'll specifically be focusing on directional terms within the much larger context of standard medical terminology, giving you the exact, precise language healthcare pros use to describe the human machine.
To really see why this matters, I want you to consider a specific question. Let's say a doctor's note says a patient has a scar above the wrist. Okay, where exactly is that? Are we talking about on the forearm, maybe 2 or 3 inches away from the hand? Or is it literally right at the base of the hand itself? Is it on the palm side or the back side? Now, in everyday life, this might just seem like a simple miscommunication, right? But in medicine, ambiguous language is straight up dangerous. Using highly precise anatomical terminology, most of which comes from ancient Greek and Latin, by the way, completely eliminates this ambiguity. It ensures that when a surgeon, a nurse, or a radiologist looks at a chart, they are all zooming in on the exact same coordinate on our biological map.
So here's the legend for our anatomical map today. We'll kick things off with the language of anatomy, establish the anatomical position, really dig into navigating directional terms, slice the grid with body planes, and finally, map out the body cavities and regions.
All right, let's jump straight into Section 1, the language of anatomy.
Okay, let's dive into this. When we look at the human body, we're really looking at two totally intertwined sciences, anatomy and physiology. It helps to think of anatomy as the physical geography of a landscape, the actual mountains and valleys. It's the scientific study of the body's physical structure. That covers gross anatomy, which looks at the large organs you can see with the naked eye, all the way down to microscopic anatomy, looking at tiny cells. Physiology, on the flip side, is basically the weather and the ecology of that landscape. It's how those physical structures actually function and work together to keep you alive. You really can't have one without the other, but for us today, our focus is strictly on mapping the geography, the anatomy.
Moving right along to Section 2, the anatomical position. Now, to absolutely eliminate confusion, anatomists had to standardize the way they view the body. We call this the anatomical position, and I actually want you to physically visualize yourself in this exact stance right now. Imagine you're standing upright, your feet are shoulder-width apart and perfectly parallel, toes pointing forward, arms at your sides, and this is absolutely crucial. The palms of your hands are facing completely forward. By adopting this standard true north position, we get rid of any spatial guesswork. Even if a patient is lying face down on an operating table, medical professionals will still describe their anatomy as if they were standing upright in this exact palms-forward stance.
Okay, Section 3. This is a big one, navigating directional terms. Like we mentioned earlier, directional terms are the absolute core of standard medical terminology. So let's run through some rapid-fire compass points. First up, superior, or cranial, which simply means toward the head end of the body. Higher up, basically. For example, your nose is superior to your mouth. The direct opposite of that is inferior, or caudal, meaning away from the head or lower down. So your stomach is inferior to your heart. These terms let us perfectly contrast structures located above against those located below.
Now, what's really interesting about this next pair is how we definitively separate the front side of the human machine from the back. Anterior, which is also called ventral, describes the front of the body. So your kneecap, your patella, is on the anterior side of your leg. Posterior, or dorsal, describes the back. Think of a shark's dorsal fin. Your shoulder blades are located on your posterior side.
Next up, we have a really special set of terms that are primarily used for the limbs, proximal and distal. Proximal describes a position that's nearer to the point of attachment to the trunk of your body. Distal, like the word distance, means farther away from that point of attachment. Think about your arm for a second. Your elbow is proximal to your wrist, right? Because the elbow is closer to your shoulder joint, where it attaches to the trunk. But your fingers are distal to your wrist because they're further away from that main trunk.
Our final compass points deal with the very center of the body. Imagine a perfectly straight line dropping right down the exact middle of your body. Medial means moving toward that midline. For instance, your heart is medial to your lungs. It's closer to the center. Lateral means moving away from the midline, out toward the side of the body. Remember our anatomical position with the palms facing forward? In that stance, your thumb is lateral to your other fingers because it's sitting further out from that center line.
I highly recommend you mentally screenshot this table. When we talk about the larger context of standard medical terminology, these specific directional terms are literally the bedrock. Every diagnosis, every surgical procedure relies on this exact vocabulary. By locking in these binary opposites, superior versus inferior, anterior versus posterior, proximal versus distal, and medial versus lateral, you're creating a fail-proof reference grid for navigating the entire human body.
All right, let's keep building. Section 4, body planes and sections.
To take our mapping capabilities to the next level, we use planes. These are imaginary two-dimensional surfaces that pass right through the body. If you've ever seen modern medical imaging, like a CT scan or an MRI, they rely entirely on these planes. The sagittal plane slices the body vertically right down the middle into left and right sides. The frontal, or coronal plane, divides the body into anterior and posterior, so front and back portions. And finally, the transverse, or axial plane, divides the body horizontally into superior and inferior, upper and lower portions. That's what we commonly call a cross-section.
And finally, Section 5, body cavities and regions.
So the crucial point here is that our mapped grid protects distinct physical territories, or cavities, which safely house our vital organs. We've got two main ones. The dorsal cavity is posterior, in the back, and it houses the incredibly delicate central nervous system. We're talking the brain and the spinal cord, entirely protected by bone and layers of tissue. On the flip side, the ventral cavity is anterior, in the front, and it's much larger. It has to be because it allows for significant changes in the size and shape of our internal organs as they do their jobs. It contains the lungs, the heart, the stomach, and the intestines.
Now, right inside that huge ventral cavity, there is a major geographic border. We call it the diaphragm. It's this dome-shaped muscle, and while it is absolutely critical for breathing, structurally, it acts like a physical wall. It separates the superior thoracic cavity, which holds your heart and lungs, from the inferior abdominopelvic cavity, which houses your digestive and reproductive organs.
To make communicating about that massive abdominal pelvic area a little bit easier, healthcare providers essentially draw an imaginary cross right over a patient's navel, or belly button. This creates 4 distinct quadrants: the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. And here's a pro tip. Right and left always refer to the patient's right and left, not yours as the viewer. And this brilliantly illustrates why this standardized map matters so incredibly much in actual clinical practice. Imagine a patient comes rushing into the emergency room with severe abdominal pain. If the doctor notes a sharp tenderness perfectly localized in the right lower quadrant, the RLQ, literally every single healthcare provider immediately knows to check for appendicitis. The appendix is sitting right there. This standardized terminology pinpoints the anatomy absolutely flawlessly.
So, we've covered the anatomical position, we navigated those vital directional terms, sliced through the body planes, and mapped out the major cavities. You now hold the legend to the map. So, let me ask you, the next time you look at a medical chart or hear a doctor tossing around complex terminology, are you just going to see a confusing list of ancient Latin words? Or are you going to see the perfect, precise coordinates of the human machine? Keep exploring, keep mapping, and thanks so much for joining me on this explainer.